It's Dr. Nicole, your board certified family medicine physician and your board certified obesity medicine physician. And I just wanted to come to you because I was asked a question this week and I wanted to explain some things. A colleague of mine said, I need to come see you, doc. And I said, yeah, you do. She knows that I do obesity medicine and I do whole person wellness and hormone optimization. And she said, well, doc, I don't need to see you about my hormones. I'm not in menopause. My doctor says I'm not in menopause. My doctor says my labs are fine, but I keep gaining weight and I can't understand why. And I told her, well, your doctor may have checked your labs, but did they check all of them? Listen, no dig to traditional doctors. I used to be one. Got trained in medical school, did my residency, and we learned about all of the things, all the labs and things that we're supposed to learn about. But what I've learned later on as I've gone through more training and as I've become more holistic and integrative medicine practices, I've learned that all of the labs that we say we check and that we say are normal are not necessarily a true representation of what is optimal for whole person health. What I've also learned is that in traditional medicine, in Western medicine here in the United States, we wait a lot of times until things have completely gone awry before we address them. So we don't try to prevent illnesses and conditions. We wait until the condition is full blown. So what does that mean? It means maybe if we had caught some things earlier, we could have prevented it from getting there. So with obesity medicine and with hormones, I work on optimizing people's current and watching trends and seeing, can we prevent things before they get to be all the way full blown? So when my colleague said to me, my labs are normal, she could be a bit disillusioned. Let me show you a picture. All right, let's go to the board. This is a bell curve. You've heard of a bell curve? A bell curve basically shows what 85% of all of the results have shown, okay? So when you go get your labs done, what comes back as that reference range, which people think are the normal range, is technically not a normal range. It's just what did 85% of the people who took that lab in that area, what did it show? For example, the labs here in Columbia, South Carolina, reference range is going to be different from the lab's reference range in New York, okay? Because 85% of the people in New York are testing different than 85% of the people in Columbia, South Carolina. So is normal technically normal, or is it just what is in that area? For example, if we look at a TSH, okay, that's the thyroid stimulating hormone, which technically is not even our actual thyroid, okay? It is a hormone in our brain that is produced when our thyroid is either working too slow or working too fast, okay? So if the thyroid is working too slow, our TSH in our brain increases to tell our thyroid, hey, you need to work a little bit faster. If our thyroid is going too fast, the thyroid stimulating hormone in our brain goes down low and says, hey, you need to slow down, thyroid, you're overworking. So a normal TSH can range anywhere between 0.4 and 4.5. So if it's anywhere in there, that's normal, right? And so most traditional doctors only check a TSH, which if it looks normal on this range, then they won't check anything else. The problem is your actual thyroid function, which is your body's regulation system, almost like a thermostat, is actually the T3 and the T4. Also, more specifically, the free T3 and free T4, okay? On a reference range, free T3 can range anywhere between 2.3 and 4.2, all right? That's what anybody can get. The problem is, as our thyroid is overworking, over time, it goes slower and slower and slower. And it's not until it gets really, really, really slow that the TSH goes really, really high. And then after that, we see it's abnormal. And then they start replacing it with medications. Versus if we had watched it trend down, we could have caught it early, okay? So what we've also found is that just because this reference range from 2.3 to 4.2 on the free T3 says that that's normal, where we find that people actually feel the best, where their body is actually optimized, where your weight is doing well, where your sleep is doing well, your skin is doing well, your bowels are moving well, your hormones are doing well, because your thyroid actually covers all of that, is when you're actually between 3.8 and 4.0. So on this end of the curve, we don't say that if you have a 2.6 free T3 that you're doing well. you're not feeling good with the 2.6 free T3. All right. So when we say, oh, they said my labs were normal, did they actually check your labs for what's optimized for you, or just what the reference range was said was normal? Let's do one more example. Vitamin D. Vitamin D reference range is anywhere between 30 and 100. That's a big reference range, right? What they also say is that, oh, anything above 30 is considered normal. Well, is it? Or what is optimized? What have we found that actually works the best? Where we find people feel the best. Now, vitamin D helps with our sleep. It helps with our bones. We know that. Everybody says, oh, you got to have strong bones. You got to eat your vitamin D. Get your sunlight. But vitamin D also helps our brain function. If you're having problems with your memory, if you're having problems with your mood, if you're having problems with chronic pain, if you're having problems with your immune system, even your heart, all of this is linked to vitamin D. I'm going to come back later on and do another talk about the new studies that are out about vitamin D. But let's just keep going with this. Vitamin D, we found, works the best for people, for example, that have chronic pain or arthritis or bone pain if your levels are between 50 and 70. 50 and 70 is where you would do best with your vitamin D. But technically, some doctors would say, oh, if you have a vitamin D of 30, you're doing pretty good. No, when you're between 30 and 50, I actually have you on 10,000 units of vitamin D a day. Okay. Then if you get between 50 and 70, then I'm bringing you down to 5,000 units a day. Once we get above 70, then I'm bringing you down to either 1,000 or 2,000 a day, which is what the over-the-counter dosing usually is. Okay. So again, if you are having problems sleeping, problems with your bones, problems with your immune system, problems with your mood, problems with your memory, all of these things as we see when we're getting older, a lot of times it could be because we're vitamin D deficient. We don't go out in the sun enough. We don't get enough sunlight. So because of that, our vitamin D levels are low. One more quick one, testosterone. The forgotten female hormone and the hormone that a lot of guys, of course, are worried about. Now, testosterone is not just about our sexual health. Testosterone also helps, again, with our weight, with our muscles, with our energy, with our brain, with our memory, with our ability to sleep well, with our bones and inflammation levels. With, of course, it does help with sex as well, but it can even help ladies with night sweats and with hot flashes. People think that that's just estrogen, but that's also testosterone. The normal reference range for men said testosterone could be anywhere between 200 and 1200, right? So when you come back with a testosterone level of 244, your doctor says, oh, you're normal. No, fellas, testosterone levels 244, that's actually really, really low. Okay, that's not normal. Men feel the best when their testosterone is between 900 and 1100. That's when men feel the best. That's when their weight is going down. That's when their bodies are burning fat. That's when they're sleeping well. That's when their memory is on point. That's when their bones aren't aching and hurting. That's when their mood is being stabilized. That's when they feel the best. Okay, so guys, when your doctor tells you, oh, your labs are normal, you might want to actually take a look at the actual numbers and bring that to a doctor that practices integrative medicine or holistic medicine who can actually tell you the details of what's going on. This is what I tell my patients all the time. You're the captain of your ship. I'm just the first mate. I'm here to help guide you as you're driving your ship. And if you don't know how your ship works, then you won't know where you're going. So I'm here to help break down the numbers to you, but not just off of numbers. I don't just treat numbers, I treat people. So I take your symptoms and I take your numbers, and then we can combine that together to make a plan that's specific for you. So what does all this mean? Well, if you are feeling tired, run down, headaches, muscle aches, joint pains, problems with your memory, problems where you can't recall the words, if your weight is going up, if you feel like you're exercising, you're eating right, but you still are gaining, your clothes are still fitting tight, if you feel like you can't sleep, if you feel like your sex drive is low, ladies, if you're having problems with dryness, if you're having painful intercourse, fellas, if you're having problems with erectile dysfunction, or decreased libido as well. If your mood is all over the place and erratic, you're happy one minute, you're sad the next, you're irritable for no reason, all of these things can be signs of low testosterone, but can also be signs of low thyroid, or what we call subclinical thyroid function. And if that's the case, we can do some things to help treat it, and not always with the pill, sometimes with some lifestyle changes. All right, so this is the things when you tell me, hey, I'm having all of these symptoms, all of these issues, but my doctor says my labs are normal, this might be the reason why. You need to come see me for an appointment, and let's get your hormones optimized. Let's get all of your hormones, your vitamin D, your thyroid, your testosterone, your estrogen. All of these things need to be optimized to have a healthier, better you. All right. I learned this one thing, and then I'm going to wrap this up. They say, do we lose our hormones because we age, or do we age because we lose our hormones? And I honestly think that we age because we lose our hormones. Back when we only had a life expectancy live to be 40, it was okay that all of our hormones were gone in our 40s. But now that we're living to be 80 and 90 and 100 years old, do you really want to live the last 40 to 60 years of your life miserable? No, you don't. And honestly, we start to lose our hormone levels, ladies, in our 20s. Okay, we start to lose our hormone levels, even fellas, in your 30s. So those hormone levels are going down. We can get them before they're all the way gone. We can catch those early. And that's when you need to see someone about optimizing your hormones, optimizing your life. Again, I'm Dr. Nicole Edwards. I'm a board certified family medicine physician, a board certified obesity medicine physician, and I help my patients to optimize their health, their happiness, their hormones, their weight, and their overall wellness. Come see me at Abundant Life Concierge, located in Columbia, South Carolina, and let's get you feeling better and get your life optimized, get your hormones optimized, get your labs optimized, and let's get you feeling great about yourself. You guys have a great one. Bye-bye.